Health and Human Services Secretary Robert F. Kennedy Jr. is promising to investigate vaccine injuries, prompting questions for parents. Scripps News Group's Stephanie Liebergen digs into what's happening around state vaccine access.
With turmoil at the CDC, questions are swirling about vaccines and who should get them. While some states are banding together to ensure Americans don't lose access, others are working to eliminate mandates that have been in place for decades. California, Oregon, Washington, and Hawaii are launching the West Coast Health Alliance to provide unified recommendations. The alliance says it will safeguard scientific expertise, and the states will coordinate their health guidelines based on advice from national medical organizations. Other state leaders are also making moves to protect vaccine access in the face of potential changes at the federal level. Minnesota Governor Tim Walz signed an order to ensure the COVID-19 vaccine remains available. New York Governor Kathy Hochul signed a 30-day executive order making it easier for pharmacists to prescribe and provide the COVID-19 vaccine. Ohio's Republican Governor Mike DeWine and his health director are continuing to promote vaccines as safe and effective. But Florida is going the other direction, and it became the first state to announce plans to end vaccine mandates in schools. A proposed rule change is underway to lift requirements for hepatitis B, chickenpox, and pneumococcal diseases such as meningitis. That could go into effect in early December. Eliminating other requirements like vaccines for measles, polio, diphtheria, and more will require a change in state law. Medical experts say the Florida Surgeon General's announcement runs counter to decades of public health advice.
He is representing the medical freedom movement, which is to say, I'm going to do what's best for my child. I don't care about how that affects somebody else. Whereas in public health, you do care about the person next to you. And I think President Trump alluded to that.
On Capitol Hill last week, senators grilled Health and Human Services Secretary Robert F. Kennedy Jr. about his view on vaccines.
I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations. And the same is true with vaccines. And we don't understand the risk profile.
After that hearing, President Donald Trump said he likes that Kennedy is different. But the next day, the president expressed caution about rolling back vaccine use.
You have some vaccines that are so incredible. And I think you have to be very careful when you say that some people don't have to be vaccinated.
Next week, the Advisory Committee on Immunization Practices will meet. It will be the second meeting since Kennedy fired the 17 previous members and handpicked their replacements. The panel is scheduled to discuss vaccines for COVID-19, hepatitis B, measles, mumps, rubella, and chickenpox, and RSV. If the advisory panel recommends any changes to the vaccine schedule, those changes will need approval from the CDC director. Stephanie Liebergen, Scripps News Group, Washington.